Hi, this is Dr. Dumestre. So thank you for this excellent question. So this patient had a double mastectomy for breast cancer and initially had implant placed for her reconstruction. She then went on to need radiation, and one of the known side effects of radiation is capsular contracture or tightening of the entire breast envelope around that implant. This can be from mild to severe. Unfortunately, she was affected severely, so she's got a tight, high, very painful implant secondary to all that radiation. So she's now looking to have her implant removed and to have a DIEP flap transfer, that living tissue transfer with skin and fat from belly to breast. So the question is, first of all, are we able to clear out the damaged tissue? So partially. Often when you have that really thinned radiated tissue, we'll end up removing a portion of it. Anything that's really, really thin, that doesn't have good blood flow, or that's very restrictive, constraining, and doesn't allow us to put in enough of that healthy tissue. So going to your question, is skin always transferred? With the DIEP flap, not necessarily. The skin is always harvested. So you've got skin and then big piece of fat. And then often what we'll do is skin can't live underneath skin. So I'll remove just the top layer of skin and then just put in the fat. Now, often with a radiated, constricted high breast, if that skin is really damaged, then we will need to transfer some actual belly skin so that, for example, say your breast is sitting really high and tight and all of this skin underneath here is really, really poor. So then what we do is cut out some of that skin, release all of that, but now you just have covering enough for a tiny little breast. So then the belly skin is actually used to give extra skin, give some of that natural breast, and allow us to expand that fully contracted area. As far as whether it helps lymphedema, if you're doing the DIEP flap without lymph node transfer, sometimes it can make it slightly better just from release of all of that scar tissue and bringing in that healthy non-radiated tissue. It's also been described harvesting the DIEP flap with simultaneous lymph node transfer into the armpit so that you can get some potential improvement of that lymphedema. That is not a surgery that's performed by a lot of microsurgeons, so it just depends where you live and if you have access to that. Otherwise, in general, patients are very, very happy when they get their constricted radiated implant out and they get their not nice, soft, DIEP flap in. They feel a lot better, they look a lot better, and it's really great.